Committee. Today's subcommittee hearing will have two parts. One will be health-related issues and the other human service-related issues. We will be taking public comment after each discussion and agenda item, and we would like to limit public comment to 2 minutes per person, and we're going to stick to that so we have an opportunity to hear from everyone who is here. And this afternoon we are also going to begin with vote-only items on the agenda, and these are items that we have previously reviewed in the committee, so we're going to move just to the votes at this time. So the first item is the Office of the Agency Information Officer dealing with CHHSA governance. A motion is in order for that measure.
So moved.
Moved by Senator Monning. Members, what is your pleasure on that item?
Aye.
Aye. So that passes with 3 ayes. The next item under vote only is the Office of the Patient Advocate. A motion is in order on that item as well. So moved by Senator Monning. Members? We have 2 ayes, passes on 2 ayes and 1 no. Thank you very much. And then the next item is Cal Ojai and the HIPAA compliance. So moved by Senator Monning. 3 ayes, that motion passes. The next item is transfer of medical privacy breach program to the Department of Public Health. A motion's in order.
So moved.
Moved by Senator Monning. Members? 3 ayes. That matter passes with 3 ayes. And then the next item is the Office of Statewide Health Planning and Development. Oh, excuse me. Strike that. The next item is a Song Brown Primary Care Residency motion, and I know Senator Monning would like to be recognized to make a comment on that item.
Yes, thank you, Madam Chair. As we discussed, this has a recommendation of approve, and I would like to request that we hold that open pending further conversation. This does relate to the programs of trying to support primary care residency and expansion of workforce. I think there may be some confusion because we do have another agenda item later at page 23 of today's agenda for a new appropriation, also supporting an increase in funding for various primary care specialty residency programs in the amount of $25 million from the general fund, which we'll discuss later in today's agenda. But just to kind of reconcile our better understanding, I would like to request that we hold this item open for today's calendar.
Okay. Is there any objection to that? All right.
Thank you.
We will move forward and leave that item open for now. Our next item is the Mental Health Services Act Workforce Education and Training 5-year plan funding. Motions in order.
So moved.
Moved by Senator Monning. Members?
Aye.
All right. That matter will pass on a vote of 2 ayes and 1 abstention. And we will move on to our next item, which is the reallocation of the California Endowment grant funding for workforce development. Members, a motion's in order.
So moved.
Moved by Senator Monning. Members? Aye. Aye. That matter passes on a vote of 3 ayes. Our next item is licensing and certification, licensing standards for chronic dialysis clinics, rehabilitation, and surgical clinics under the Department of Public Health.
So moved.
Senator Monning moves. Members? Aye. 3 ayes. That matter passes. Then the next item is the Office of AIDS, OAHIPP, the RAP for out-of-pocket medical expenses. Members, a motion is in order.
So moved.
So moved by Senator Monning. Members? That matter passes on a vote of 2 ayes and 1 abstention. And the next item, members, is the item Infant Botulism Treatment and Prevention Program. Members? Moved by Senator Monning. That an aye for me too. That matter will pass on a vote of 3 ayes. The next item under the Department of Healthcare Services is the recertification of the drug Medi-Cal providers. Members?
So moved.
That matter has a motion by Senator Monning. Members? That matter will pass on a vote of 3 ayes. Our next item on the agenda is the Substance Use Disorder Program Integrity Counselors and Facility Complaints Members. This item is being pulled from the agenda today because we will have additional information forthcoming. So we will schedule this at a later hearing so we can review the new information that is becoming available. Our next item is the continuation of driving under the influence program evaluation. Members? Moved by Senator Morrell, and that passes on a vote of 3 ayes. Thank you, members. Yes, and also we do have vote-only items on the Human Services agenda as well today, and we are going to move to those next. So I'm going to pause just for a moment so everybody can make sure we are on the same page. So we are moving to the agenda on Human Services, item number 1. We do have several items for vote only on this agenda as well. So the first item on the Human Services agenda today is under the Department of Aging. Excuse me just a moment. All right, so we are going to go to the first item, which is under the Department of Aging. It's the April letter Health Insurance Counseling and Advocacy Program Augmentation. Members, motions in order. Moved by Senator Monning. Members, what is your pleasure? Aye. Aye. That matter will pass on a vote of 3 ayes. The next item is traumatic brain injury supplemental funding. Members, is there a motion? Moved by Senator Monning. Members? Aye. 3 ayes on that matter as well. It passes. The next item is case management information and payrolling system 2 under the CMIPS 1. Members, motions in order on that item as well. So moved by Senator Monning. Members? Aye. Oops. This is the case management information and payrolling system?
Under 5160.
Yes. Yes, okay, very good. That item has a motion by Senator Monning and passes on a vote of 3 ayes. The next item is the Affordable Care Act caseload growth and case management system. Moved by Senator Monning. Okay. Yes, it's the Affordable Care Act caseload growth and case management system. Thank you very much. That item will pass on a vote of 3 ayes by Senator Monning's motion. And we will have one last item. And that item is the California Child Support Automation System Information Technology Contract Staff Reduction. Motion by Senator Monning. And that bill passes with 2 ayes and 1 no. Is that the correct vote? Yes? 2 ayes and 1 no. Thank you very much. All right. Now we will move back to the rest of the agenda under healthcare services. And we will stop for a moment to make sure we're all on the right page. We are on page 16 of the agenda. And the first item is the Medi-Cal Renewal Assistance Grant from the California Endowment under the ACA as part of the Department of Healthcare Services. And welcome. Please introduce yourselves this morning and proceed.
Thanks, Madam Chair. Mary Cantwell, Chief Deputy Director of Department of Healthcare Services. So I'll be doing this item. As the agenda notes, the California Endowment has committed funding to provide the ability for the department to pay for application renewal assistance. They had committed similar funding last year that was used to pay for application assistance. In terms of this proposal, we don't currently have a position on it. Obviously, we're very appreciative of the offer. We do want to sort of think through how to best make use of this money. Make sure we understand the interaction with how the counties and the eligibility workers and their responsibilities for renewal efforts. And we're also aware of recent decisions by Covered California to relook at their program for application assistance, moving away potentially from individual payments to more a grant-based program. And so we think, it's worth thinking through whether that type of approach might be better suited for this kind of funding. So we definitely are appreciative of the funding and just really want to think through the best use of the money.
All right. I think that provides the overview. Members, are there any questions? All right. Department of Finance, do you have any comments?
Yes, good afternoon, Madam Chair, members. Carlos Kwan, Department of Finance. I just wanted to clarify that this proposal is not an administration proposal, and although it doesn't require any general fund, we are anticipating an estimated general fund impact of $8.7 million of increased costs in the program.
Okay, thank you very much. Legislative analyst. All right. Public comment.
Beth Capel on behalf of Health Access California. We are one of the sponsors of this proposal to help consumers renew their coverage and remain in their Medi-Cal. The existing funding help people, over 1 million Californians obtain coverage.
We can hear you up here. I just don't know if it's on the record.
Try this one.
The existing funding helped over 1 million Californians to obtain coverage in Medi-Cal, and we want the consumers to have the opportunity to come back to the same people that helped them get coverage the first time. The actual experience with most outreach efforts in the state has been that about a third of those who are uninsured are eligible for Covered California, about a third are eligible for Medi-Cal, and about a third are undocumented. So we do think for those who enrolled in Medi-Cal as a result of the many changes we made last year that they should have the opportunity to go back to the same people who helped them the first time. Thank you.
Thank you very much for your testimony.
Madam Chair and Senator Monning, Elizabeth Landsberg with the Western Center on Law and Poverty. We're the other co-sponsor of this measure. We appreciate Ms. Cantwell's comments about wanting to make sure the money is used as sensibly as possible, and we're open to that conversation with the department. We are concerned, this committee is very well aware of the Medi-Cal backlog. There's certainly no intention to duplicate the efforts of the county workers, but they're quite frankly overwhelmed, and so if they can get forms filled out correctly the first time, I think it's a benefit to all of us to get that backlog cleared. The administration has insisted on sending out flawed renewals at the time of the backlog, so we think it makes sense to work together to try to make sure there are as many resources for consumers, again, to fill out these forms. This year is particularly important as we move from the current welfare-based rules of Medi-Cal onto the new ACA tax-based rules, and so we think consumers will need assistance with that. We've been pleased to work with the department to try to improve processes as much as possible, but think consumers will need some assistance. We appreciate your consideration. Thank you
very much.
Sarah DeGee on behalf of the California Pan-Ethnic Health Network, in support of this measure as well. It's really important for consumers to have as much assistance possible in navigating these waters, and so we're supportive of this proposal.
Thank you very much.
Madam Chair, members, Doug Kim with the Primary Care Association. We agree with the prior speakers, and we're in support of this proposal.
Thank you very much. All right. Any other comments, questions by members? Senator Monning.
Just a quick comment acknowledging the contribution of California Endowment that I understand does leverage an equal amount of federal money. Is that accurate?
That's correct.
But then there's an additional general fund allocation. Is that correct?
I'll let Department of Finance speak to that.
There'd be additional general fund costs to provide the benefits to the folks who would have otherwise not maintained their coverage as a result of the proposal, but no general fund is needed up front.
Thank you.
All right, thank you very much. A motion is in order. Senator Monning?
Move the adoption of placeholder.
All right, so we have a motion. Should we leave it open or? Okay, we'll take a vote and leave it open. A motion by Senator Monning, 2 ayes. We'll leave that item open on call for the vote. Thank you. And our next item, excuse me, is Merge California Institute for Mental Health and Alcohol and Drug Policy Institute. Welcome again.
Thank you. Brenda Graylish, Chief of the Mental Health Services Division at the Department of Healthcare Services.
Thank you.
So the merger of the California Institute of Mental Health and the Alcohol and Drug Policy Institute will officially occur on July 1, 2014, so this year, and will be named the California Institute for Behavioral Health Solutions. So this merger was driven by the desire or by the similarities between the two organizations, and particularly now, from a state perspective, since the former Community Mental Health Services side of the former DMH, Department of Mental Health, and Alcohol and Drug Programs has merged under the Department of Healthcare Services. We believe this will further the integration efforts between the two. Essentially, these two organizations serve the same customers, including counties, community-based organizations, and healthcare organizations. They focus on research and evaluation, training and technical assistance, and informing policy development at the federal, state, and county levels. So again, we think this merger is going to benefit our target population as it results in one inclusive system that can work to ensure that consumers have access to integrated care, and so therefore we don't have any concerns and support.
Okay, thank you very much. So you don't have any concerns, that's good. Any other questions, members? I think that covers it. And Ms. Goodwin, did you want to make a remark?
Certainly. I'm the executive director, Sandra Naylor Goodwin, the director of the California Institute for Mental Health. We often call CIMH, shorthand. The whole purpose of this is we're working very much on the integration of services for consumers at the local level with the Department of Healthcare Services and with counties. And as we do that, we acknowledge that about 80% of our clients have both conditions. They don't often come singularly. So with that, we think that it's really important that we do this merger and add these amendments, which is simply add substance use disorders to the work that we do on behalf of the state and the counties.
Thank you very much for presenting. All right, Department of Finance, do you have any comments?
Greg Washington, Department of Finance. We have no position at this time.
Thank you very much. Legislative Analyst? Public comment? All right. Members, what's your pleasure? Member?
Placeholder trailer bill language.
Okay, we have a motion for the adoption of the placeholder trailer bill language, and we have 2 ayes, and we'll leave that on call. Thank you very much.
Thank you.
Thank you. All right. Our next item is health-related proposals for restoration and augmentation. And the legislative analyst has a presentation.
Yes, thank you. Sean Martin with the Legislative Analyst's Office. We've been asked to present, by my count, there are 26 separate proposals here. And my colleague and I, Amber DG, will be presenting them. Where they fall in the Department of Public Health area, my colleague will do the presentation and I'll be presenting the others. And we note that these are not department or administration proposals or LAO proposals. That we believe they're all proposals brought forth by various interested groups.
Thank you very much.
Sure. So I will let my colleague start off.
The first proposal is for a restoration of $10.7 million in general fund for the Adolescent Family Life Program. This program addresses the social, health, educational, and economic consequences of adolescent pregnancy by providing comprehensive case management services to pregnant and parenting teens and their children. Funding for the program was reduced in 2009. The next proposal is a request to add the Adverse Childhood Experience Survey questions to the existing California Behavioral Risk Factor Surveillance System. As noted in the agenda, the Department of Public Health recently announced that it plans to use funds from an increase in the Federal Preventive Health and Human Services Block Grant Award to fund the addition of these questions to the survey. The next proposal is for an expansion of eligibility for the AIDS Drug Assistance Program and the Office of AIDS Health Insurance Premium Payment Program to consider family size when evaluating income and to consider using the modified adjusted gross income standard used by Medi-Cal in covered California. According to the agenda, this would have unknown special fund costs and potential general fund pressure. The next proposal is for up to $2.65 million in general fund for the biomonitoring program. According to the proposal, giving up potential reduction in federal grant funds, advocates are requesting the state funding to continue the work of the biomonitoring program. This program determines levels of environmental chemicals in a representative sample of Californians and establishes the trends in these levels over time. The next proposal is for $3.9 million in general fund for the Black Infant Health Program. This program was created in 1989 to address a disproportionately high infant mortality rate for Black infants. The program still operates in 15 local health jurisdictions in California, and funding for this program was cut by $3.9 million in 2009. The agenda notes that the Department of Public Health recently announced that it plans to use funds of $300,000 from an increase in the Federal Preventive Health and Human Services Block Grant Award for this program.
The next proposal is for $2.9 million general fund for caregiver resources centers. They are community-based centers that offer services to families designed to assist unpaid family caregivers of adults with chronic disabling health conditions. Funding for the caregiver resource centers was reduced in 2009.
The next proposal is for $3.2 million in general fund for the dental disease prevention program. From 1980 to 2009, this program provided school-based oral health prevention services to approximately 300,000 low-income school children in 32 counties in California, and approximately $3.2 million in general fund was eliminated from this program. The next proposal is for $2 million in general fund for the Drug Overdose Grant Program. The Drug Policy Alliance requests to establish a grant program for local agencies and community-based organizations with the aim of reducing the rate of fatal drug overdose caused by prescription analgesics and other drugs. The next proposal is for $15 million in general fund for the Early Mental Health Initiative. Prior to 2012, the state provided $15 million in general fund for this program, which sought to identify very young school-age children who exhibited mental health risk signs and provide those kids with various supportive services. This program had been operated through the former Department of Mental Health, and when the program was eliminated, or when the department was eliminated, it was transferred to the Department of Education. However, CDE has never operated this program, as all of the funding was eliminated the same year that the program was transferred.
The next proposal is for $27 million in general fund for the expanded access to primary care. The proposal would expand access to preventative health care for the medically underserved by ensuring that safety net providers have resources to cover uncompensated care.
Next proposal is for $7 million general fund for HIV/AIDS initiatives in mid-size and small counties. This proposal would fund HIV/AIDS initiatives focused on outreach, screening outside the medical setting, linkage, and retention in mid-size and small counties. The next proposal is for $2 million in general fund for HIV prevention demonstration projects. Advocates propose to support at least 3 public health demonstration projects to allow for innovation, evidence-based approaches to outreach, screening, and linkage to, and retention in, care for the most vulnerable Californians living with and at risk for HIV disease. The next proposal is for $3 million in general fund for the HIV prevention pre-exposure prophylaxis, or PrEP. Advocates propose 3 demonstration projects which would explore the cost, benefit, and health outcomes of offering PrEP to residually uninsured individuals in high-impact areas, PrEP is a new FDA-approved drug that prevents HIV infection in at-risk individuals. The next proposal is for $3 million in general fund for HIV prevention, post-exposure prophylaxis, or PEP, and PrEP education. Advocates propose funding for these two types of education. The next proposal is for $5 million in general fund for the HIV prevention syringe access programs. Advocates propose funding for clean syringe access programs with the aim of preventing HIV and hepatitis C infections among injection drug users.
The next proposal is for $500 to $600 million general fund for Medi-Cal primary care rate increase. The Affordable Care Act required Medi-Cal to increase primary care physician services rates to 100% of the Medicare rate for services provided from January 1st, 2013 through December 31st, 2014. The state received 100% federal funding for the incremental increase in Medi-Cal rates. Federal funding for this incremental rate increase expires December 31st, 2014. This proposal would continue to fund this rate increase with state funds.
The next proposal is for $20 million general fund for mental health peer respite pilots. County mental health departments request funding to provide support through peer respite for people experiencing psychological distress.
The next proposal is for $77 million general fund for optional Medi-Cal benefits. The 2009 budget eliminated several Medicaid optional benefits from the Medi-Cal program. These benefits were eliminated for budgetary reasons in response to the fiscal crisis. And
the next proposal is for $1 million in general fund for the public health laboratory training program. The 2012 budget eliminated $2.2 million general fund for this program. The Health Officers Association of California proposes to restore funding, but with modifications to the program, such that the assistants be limited to assistant lab directors employed in local public health labs. These individuals would be eligible for a 4-year commitment to the funds, thereby allowing them to accrue the 4 years of lab experience necessary to become a public health lab director.
so we skipped one. We're going to go back. The prior proposals for $25 million general fund for primary care residency. The physician associations request an increase in funding for various primary care specialty residency programs. And now I'm going to go on to the safety net services for the remaining uninsured. This proposal would provide health coverage to remaining uninsured after implementation of the Affordable Care Act and recent changes in health policy, and the cost is unknown.
The next proposal is for $10 million in general fund for school-based health centers. This proposal would fund the Public School Health Center Support Program, an unfunded grant program already in statute. The next proposal is for $2.5 million general fund for school-based mental health. This proposal is for pilot programs that aim to demonstrate that partnerships between county mental health and schools can provide additional support for students and may result in savings in special education.
The next proposal is for $2 million general fund. It would the sexually transmitted disease prevention and services would provide free STD screening, testing, and diagnosis, and free chlamydia and gonorrhea treatment, and support outreach and education in 3 counties with high STD rates that lack sufficient resources and infrastructure to provide adequate STD services to the uninsured populations. The fund would support outreach and education, evaluation, training, and program administration. And these pilot programs would operate from July 1st, 2014 through June 30th, 2016. The next proposal is $10 million general fund for teen pregnancy prevention. The proposal would restore funding for teen pregnancy prevention efforts by funding the Community Challenge Grant program. The Community Challenge Grant funds a variety of community-based teen pregnancy prevention programs to help adolescents avoid unintended pregnancy and sexually transmitted infections. And the final proposal is for $8.8 million general fund for the Tuberculosis Trust Fund. This would provide funding to ensure that tuberculosis expertise through an augmented or dedicated position in all 61 local health jurisdictions.